Cancer is one of the most feared words in medicine. It's a disease that affects people across all ages, genders, and backgrounds. The journey of a cancer patient often begins with the uncertainty of an early diagnosis, followed by the overwhelming emotions of fear, shock, and disbelief. Yet, over the past few decades, advances in medical science have transformed the way we treat cancer. Today, many cancer patients can look forward to better outcomes, with new therapies, improved surgical techniques, and advanced technologies offering hope where there was once little. This story explores the complexities of cancer, the treatment options that have evolved, and the incredible advances in medical science that have redefined what it means to fight cancer. It will offer insights into the treatments used to manage and cure cancer, while also providing hope for those battling the disease. The journey for a cancer patient begins with the moment of diagnosis, which can often come as a shock. For many, cancer starts with something simple: a lump, unexplained pain, or a persistent cough. These seemingly insignificant symptoms may lead an individual to visit their doctor for a checkup. Soon, tests such as blood work, imaging scans, and biopsies follow, leading to the dreaded diagnosis: you have cancer. This diagnosis is rarely expected, and for most, it strikes fear and uncertainty. The word cancer is powerful, evoking emotions of despair and vulnerability. Not only does the individual now have to process the diagnosis, but they must also prepare for the long road ahead that is fraught with treatments, hospital visits, and lifestyle changes. It's a journey that many have traveled before, but each one is unique, marked by its own set of challenges and triumphs. For the person diagnosed with cancer, their loved ones are also affected. The ripple effect of cancer can be seen in families, friendships, and relationships. As the patient contemplates their future, those around them also begin the difficult process of navigating the unknown, trying to offer emotional support while struggling with their own fear and uncertainty. The physical, emotional, and psychological toll that cancer takes on both the individual and their family cannot be understated. But amidst the shock and fear, there's also a glimmer of hope. Over the years, the fight against cancer has evolved, and modern treatments have given patients a better chance of survival than ever before. For decades, chemotherapy and radiation therapy have been the primary treatments for cancer. These treatments have saved countless lives, even though they often come with harsh side effects. Chemotherapy works by using strong drugs to destroy rapidly dividing cells, which is the characteristic nature of cancer cells. Chemotherapy is often given intravenously, although some drugs can be taken orally. The drugs used in chemotherapy are designed to attack cancer cells, but they also affect healthy cells, leading to side effects such as nausea, hair loss, and fatigue. Despite these side effects, chemotherapy remains one of the most widely used and effective treatments, particularly for aggressive cancers like leukemia, lymphoma, and breast cancer. On the other hand, radiation therapy uses high-energy beams of radiation to target cancer cells in a specific area. It is often used to shrink tumors before surgery or as a follow-up treatment after surgery to ensure any remaining cancer cells are destroyed. Radiation can be highly effective for localized cancers, and it is less invasive than chemotherapy. However, like chemotherapy, radiation can also cause side effects, such as skin irritation, fatigue, and damage to surrounding healthy tissue. While both chemotherapy and radiation have been instrumental in treating cancer, they do not come without limitations. They can be taxing on the body and have side effects that can severely impact the quality of life. Moreover, the success of chemotherapy and radiation depends largely on the type of cancer and how early it is detected. For some patients, these treatments are not enough, and new options are needed. Over the past decade, immunotherapy has revolutionized the field of oncology. This treatment represents a dramatic shift from traditional methods, as it focuses on boosting the body's immune system to fight cancer. Instead of directly attacking cancer cells, immunotherapy helps the immune system recognize and destroy cancer cells. One of the most groundbreaking forms of immunotherapy is checkpoint inhibitors. These drugs, such as pembrolizumab, Keytruda, and nivolumab, Opdivo, block the checkpoint proteins on cancer cells that normally allow them to evade detection by the immune system. By preventing this immune checkpoint, the drugs help the immune system recognize cancer cells and attack them as if they were foreign invaders. Immunotherapy has shown remarkable success in treating certain cancers, such as melanoma, non-small cell lung cancer, and bladder cancer. Unlike chemotherapy, which affects both cancerous and healthy cells, immunotherapy tends to have fewer side effects and provides longer-lasting results. However, it is not a cure-all. Not all patients respond to immunotherapy, and the cost can be a significant barrier to access. Another innovative immunotherapy treatment is CAR T-cell therapy. This cutting-edge therapy involves taking a patient's T cells, a type of white blood cell, modifying them in the lab to better recognize and fight cancer, and then reinfusing them into the patient's body. CAR T-cell therapy has been especially effective in treating blood cancers like leukemia and lymphoma. While still a relatively new treatment, it has already shown impressive results, and ongoing research is expanding its potential to treat other types of cancer. Immunotherapy has brought hope to many patients who were once deemed untreatable. For those who benefit from it, immunotherapy represents a new era of cancer care, one where the body's own defenses are enlisted in the battle against the disease. Targeted therapy is another revolutionary approach to cancer treatment. Unlike traditional therapies that indiscriminately attack both cancerous and healthy cells, targeted therapy focuses on specific molecules or genetic mutations that drive cancer growth. By targeting these specific pathways, targeted therapies are designed to stop cancer cells from growing and spreading. For example, HER2-targeted therapy is used in breast cancer treatment for patients whose cancer cells have an overactive HER2 protein, a protein that promotes cancer cell growth. Drugs like trastuzumab, Herceptin, specifically target and block HER2, slowing down or stopping the growth of cancer cells. Similarly, EGFR inhibitors are used to treat lung cancer in patients whose tumors have mutations in the epidermal growth factor receptor, EGFR gene. One of the main advantages of targeted therapy is its precision. By targeting specific molecules, these treatments can reduce harm to healthy cells and minimize side effects compared to chemotherapy and radiation. However, just like immunotherapy, targeted therapies don't work for everyone. Some cancers develop resistance to these drugs over time, and finding the right treatment for each patient can take time and careful testing. Despite all the advancements in chemotherapy, radiation, immunotherapy, and targeted therapies, surgery remains a crucial part of cancer treatment. When the cancer is localized and can be safely removed, surgery is often the best option. The goal of surgery is to remove the tumor and, in many cases, surrounding tissue that may be affected by the cancer. In some cases, surgery is followed by chemotherapy or radiation to eliminate any remaining cancer cells and reduce the risk of recurrence. For example, mastectomy is a common surgical procedure for women with breast cancer, where the entire breast is removed. In other cases, surgery may be used to remove part of an organ, such as the colon or lungs, to eliminate cancerous growths. In recent years, the techniques used in surgery have become less invasive. With the advent of minimally invasive surgery, such as laparoscopy and robotic surgery, patients can undergo procedures with smaller incisions, less pain, and faster recovery times. While the primary goal of cancer treatment is to cure the disease, there are times when treatment becomes focused on improving the patient's quality of life, especially in advanced stages of cancer. Palliative care is designed to provide relief from the symptoms and pain associated with cancer and its treatments. Palliative care is not limited to pain management. It also includes psychological, emotional, and spiritual support. A team of specialists works with the patient to manage pain, improve comfort, and ensure that their final days are spent with dignity and peace. Hospice care is a specific form of palliative care that is focused on providing comfort to those nearing the end of their lives. While palliative care doesn't cure cancer, it plays an important role in ensuring that cancer patients live their remaining days as comfortably as possible, with support from loved ones and healthcare professionals. As cancer research continues to evolve, the future of cancer treatment looks promising. Genetic research and personalized medicine are changing the way doctors approach cancer care. By understanding the genetic mutations that drive cancer, doctors can create treatment plans tailored to each individual's needs. This approach, known as precision medicine, is already being used to develop more effective treatments. In addition, artificial intelligence, AI, is playing an increasingly important role in cancer diagnosis and treatment. AI algorithms can analyze vast amounts of data, helping doctors identify cancer earlier, predict which treatments will be most effective, and even create new therapies. The potential for AI to revolutionize cancer care is limitless. Cancer remains one of the most challenging diseases to treat, but the medical advances of the past few decades have offered new hope to patients. From chemotherapy and radiation to immunotherapy, targeted therapy, and precision medicine, the treatment options available today are more advanced than ever. While challenges remain, the fight against cancer is stronger than ever, and with continued research, we can look forward to even more breakthroughs in the years to come. For cancer patients, the road ahead may be difficult, but it is filled with hope. With each new treatment, the possibilities for a future free from cancer grow more tangible. And while cancer may not be an easy battle, the medical advances we have today give patients the chance to fight, survive, and live a life full of hope.